This is Henry Ford Hospital 1915. This is it today. Not much has changed, except maybe everything. So as we exit a year of celebrating the last century, we thought, why not look into the future?
10, 20, 100 years out.
In the next decade or so.
In 50 or 100 years.
50 years from now.
Over the next 100 years.
100 years from now?
It turns out we've been trying to guess what the future of medicine might look like for a long time, often with dubious results.
Oh, it's ridiculous.
Although many times wrong, it's this kind of thinking that has brought us our most fantastic inventions. Not that fantastic, but certainly this fantastic. So we asked Henry Ford Hospital staff their ideas for the future of medicine, and just how the hospital might be in the middle of it all, just like it was a century ago.
You know, if I'm going back 1916, I'm sitting here just before World War I. If you would have told me that man would have made it to the moon in this century, I'd have said, you're crazy.
Over the next 100 years, there's really no limit to what might be possible in the future of medicine.
Yeah, when you look forward 100 years, that's a pretty daunting task.
I don't know what the future holds in 100 years.
That's a good question.
That's a good question.
Looking forward 100 years, you're tempted to just kind of jump into this science fiction mode. You think about microbial engineering, you think about sort of untwisting the human genome.
Nanoparticles and nanobots that can be directly injected into a patient's blood vessel.
The future is very bright and the opportunities are really limitless.
With technology, I think, comes a lot of wonderful innovation.
We will have advanced the treatment of conditions like stroke, conditions like heart attack, even conditions like diabetes.
We're going to be able to treat and minimize the impact of disease to a much greater extent than we've been able to do in the prior 100 years.
One of the exciting things in the future is that I might be able to go to a patient's bedside and scan my tricorder and gather all the information I need from that.
Could it really be like the Star Trek age where you wave the magic wand and things get better? That would be awesome. I can't even wrap my mind around that, but it has to be going there.
I dream of the future when we can actually not have a patient in a bed, but they're almost levitating over a surface where none of their skin is contacting a bed.
It's maybe like something on like the ceiling that can transport patients from the bed to the toilet.
Like they're floating, coming into the operating room.
But then unfortunately, I'd be out of a job.
The power of technology to transform medicine electronically, we're only just now starting to discover that.
Being able to stop cancer from happening before it happens is of utmost importance. We may be treating cancer with purely just medication, something as little as a pill.
I'm hoping in the future that there might be some injectable medicine that we can give rather than just giving TPA, but something to actually bring those cells back immediately.
Or we're going to be riding stretchers with the patients and making sure they get to one place to another safely.
Less trauma to the patient, faster recovery time, and less pain.
And this is something that's been working on now, but I think that in the next 20 years, we'll probably see much more of it, is the ability to grow tissues and organs in the lab and also do 3D printing of parts and organs.
I see a lot of doctoring or medicine happening right through your own computer or laptop or television, in which the doctor is in their office and they're counseling you based on the symptoms that you're having.
Henry Ford, I think, from the beginning has really fostered a network of physicians that have been tasked with thinking about the future.
In order to be part of the future or to be the pioneers in the future, we can't take the easy way out.
In some regards, some things don't change, over 100 years.
You still have a patient that is there and needs to be represented.
If you look at Henry Ford's mission and vision, it talks about transforming people's lives. It talks about making people's lives better.
Always searching to be better, always trying to achieve more is what's going to drive us forward to continue our innovations.
But always to have an eye for what's next, what's better.
We're going to bring more of Henry Ford Hospital into the lives and homes of our patients.
With precision medicine, genetics, there's so much more that we're going to have to know.
But what the new Cancer Center will do is it will bring us all together.
We will be personalizing breast cancer management by evaluating the genetics of an individual patient's tumor.
And we're going to continue to figure out ways to fix the heart without actually doing incisions.
I think hospitals will always be relevant because they're going to be a level of acuity of patients that can't be provided anywhere else. Patients come to the hospital not only to see their providers, but because they require nursing care. And I don't think that's something that's going to change in the future.
The future for us is actually to be that resource to take care of the sickest of the sick, the complex care patients, the things that others can't do, that we can do. And we do this not in just simple in one department or another. We do this as Henry Ford Hospital. And that is really the future that we will have. We will continue to concentrate on those areas that will bring extraordinary value to patients, extraordinary value to referring physicians, and extraordinary value to the purchasers of care.
Our bodies have a limited mileage. And so even when they're not ravaged by chronic disease, we're going to have to really focus on how to keep our patients healthy and able to make the most of their healthier bodies now that we're able to take care of these diseases and help our patients have the kind of lifestyle and outlook that we would want them to have to attain their goals to live not just a longer life, but a better and higher quality of life.